Health Minister Dr. Joe Phaahla will conduct a site visit and lead the official reopening of the accident and emergency units at the Charlotte Maxeke Johannesburg Academic Hospital. This in line with an undertaking made in March this year that the two critical units of the facility will be ready by the end of April 2022. Let's take you there live.
Those who are coming, arrangement to reduce pressure on the sister facilities in the area. So as we have seen, the first group of patients have already been moved in. So the number of clinicians who are managing that, I'm not sure whether Prof. Moeng is still here with us. He's here, yes, he was heading the accident and emergency unit, the trauma section. So a number of clinicians are managing this. So one of the areas which is a bit of a delay is that we mentioned last time that the CT scan which was available was vandalized. The central processing unit of that CT scan together with other cables were vandalized and some of them stolen. So as we speak now, the contractor is on the site to make sure. We thought by now the scan would be working, but because some of the parts had to be imported, that has taken some time. Some of the components only arrived in the country this morning, so they are busy now working on that CT scan, because it also has to be recalibrated, so that, you know, because these are very sophisticated machines. So once it is fully functional, then at that stage Prof. Moeng and the team can now accept ambulances, emergency ambulances, because most of the time you do need a CT scan with patients who have not been processed anywhere else. It is indeed a very important equipment for trauma and also adult emergency patients, such as acute strokes, some of the trauma like stabs, gunshots, also with head injuries. All those require a CT scan, so you can't risk to bring in fresh patients from the accident scene, for instance, when you don't have a CT scan. So once we are quite optimistic that by the end of the week it will have been fixed. There might still be the recalibration and other aspects which need to be done, but once that is done, then the full the scan will be fully functional. Then they will be able to take trauma patients. Now, just to say again, to remind you that the rehabilitation of this hospital, it's a multi-phase and also a multi-year, but not too many years, as you will see. So it will be carried out in phases. We'll show you the phases. So we know that before the accident and emergency unit, the radiation oncology unit was already functional. So now we have the accident and emergency department, which is functional. Now, as you might be aware, that where we were, the accident and emergency unit is in block 1 in terms of the various sections of this hospital, block 1, level 6. So now that that site is almost complete, work will begin on the rest of block 1 and also proceed in a staged way, as we'll show later on. So the hospital has received the necessary occupational health safety approval certificate from the city of Johannesburg. So that's why the accident and emergency department can function. So we have all that, go ahead from the city of Johannesburg, which allows the occupation of that area and commissioning of its usage. So the clinical team now is really just working on those details. So the recommissioning of this of that area is indeed a milestone, and we are pleased that the hospital is able to relieve the pressure on the other surrounding hospitals and also community health centers. And we appreciate the staff from those, including, as we have said, Helen Joseph, Chrisani Baragwanath, who have taken a lot of strain, and we believe that increasingly that will be reduced. We are also grateful to the Solidarity Fund, which funded the work which have been completed at the Accident and Emergency Unit. Also, the Spire Fund, which was the project manager for this part of the work. All in all, it has cost 68 million rand to get that unit where it is now, and we are indeed very grateful for that relationship with the Solidarity Fund. So in terms of the remaining work, the engineering team from National Department working with the Provincial Department of Health and also with the DBSA conducted a block-by-block assessment for the entire institution, and they have developed a detailed project plan covering the milestones, which I will indicate what are the milestones. As we have seen, with the Accident and Emergency Unit, end of April, it is now functional. So we mentioned that this is in Block 1, Level 6. From here now, the rehabilitation moves to the rest of Block 1, which will include the obstetrics and gynecology, the maternity area, and to make sure that it's rehabilitated, it's compliant. That work will be completed at the end of March 2023. And then, so as work goes on in phases, Block 2 also, the work will be going on in Block 2, which is mainly a pediatrics area, and that work will complete in July of 2023. And then Block 3, which is mainly the surgery unit, surgery area, the department, that work will be completed in October next year, October 2023. And then Block 4 and Block 5, which include the internal medicine department, those will be the last ones which will be completed in November of 2023. So all the work of the rehabilitation, we hope everything goes according to plan, will be completed by December next year, which is a major improvement from the previous projections. As some of you may be aware, that initially this work was projected to take a lot more longer time. But now, where we are, it will just be, about a year and 7 months in that area, that period. The whole work will be completed. All the equipment and machines have already been installed in the accident and emergency. So the process to relocate patients from surrounding facilities, as I said, has already begun starting with the mental health users. It should also be noted that even as we activate this accident and emergency, because this is essentially a central and quaternary level of service, and also as an academic hospital, its focus is really in terms of priority 1 and priority 2 patients. So it's meant to really look after very complicated patients, mainly referrals. But so we know that because of pressure in the surrounding areas, we do get people who walk in from surrounding areas. So as I've said, that will be delayed for now. It will focus on the level 1 and level 2. So on this, because of this, we want to urge members of the public that even though we are announcing that the emergency services is open, it really does not mean that people should just walk in. They should still go to the areas where they have been receiving service, and when it's necessary, based on the assessment, then they can be referred here to Charlotte Maxeke Academic Hospital. There will be transportation, emergency services, patients transport, which will then, patients who will come here will only be those who have been transferred. So the work on the other sections is definitely underway, and we are hopeful that our team will continue with the kind of focus and urgency and diligence to make sure that, as outlined in terms of the milestones, the various units, it's going to take a while because there's a lot of work which is being done. But I need to also just emphasize the fact that to some of the public, the picture which is painted out there is as if this hospital is non-functional. I mean, people still talk of reopen Charlotte Maxeke Academic Hospital as if the hospital is actually closed. In fact, the reality is that the hospital is functioning at just around 75 to 80% of capacity. So there's still pressure because of the fact that it's not at 100%, but we want to again reaffirm the fact that as this rehabilitation to comply with the fire and safety and all other occupational safety requirements, it does not mean that this hospital has not been functional. Currently, in the hospital, there is just under 800 patients already, being serviced, admitted in the hospital. So we want to just, explain the fact that the notion that the hospital is not functional, it's actually not true. So we will keep, from the national, working together with the provincial health department. We will be working closely, making sure that we meet our commitments to the people of Gauteng and beyond, because this hospital does not only service Gauteng, it services other provinces, including my province of Limpopo does benefit, Mpumalanga, Northwest, and also in the region of Southern Africa, in the SADC region, provides a lot of service. So it's a national asset, so we will be making sure. And I want to also take this opportunity to really appreciate partners, funders who have come forward working with us. I've already mentioned the Solidarity Fund, the Spire Fund, which also functioned as a project manager. We want to thank the Spire Fund also because over and above project managing the accident and emergency, they are also providing a service in the area which was the most damaged by the fire. They are currently providing us with engineers and other technical capacity to make thorough assessment of that area so that the remedial work can also start in the area which was the most damaged, where the fire brought down the basic infrastructure. So in about by the end of June, we will be having a full report in terms of the structural damage and what needs to be done in that area where there is the parking and that. So all that will be ready. I can also just mention that also the gift of the givers has also come forward to work with us to make sure that the stores area can also be rehabilitated. So we really thank them for that. We know that there's been a lot of pressure to the staff on parking. I mean, the area which has been damaged was really the area where most of the staff, I think it took about over 1,000 cars. And now that space has been lost. So the team is working around the clock also prioritizing that area to be rehabilitated so that in the not very distant future, at least a minimum of 300 parking bays can be also be made available with that remedial action. So we want to thank appreciate the people of Gauteng and all the other people who benefit from this facility for their patience, and we want to assure them that we're not taking that patience for granted, and we'll do everything in our power to make sure that it's not extended any further. So the timelines which we have set, as we are today able to say the accident and emergency is functional, And all the other timelines, we intend to make sure that we follow our commitments and come by the end of next year that the entire hospital will be fully functional. Thank you very much to the facilitator and members of the media. Thank you.
Thank you, Minister. Colleagues, we're going to take questions immediately. I'm going to take 10 questions in 5. So it will be first 5. And then when we point at you, you will indicate to us which media house you're coming from. Then we'll take the first 5 and then go to the second 5. And then after that, we'll assess whether there's still a need for us to go too far more than 10 questions. Yeah, I'm going to take questions now with a show of hands. Yes, 1, 2, 3. I need 4. Last one, 5. Can you start in that order?
Good day, Health Minister Jill Gifford from Times Live. From Times Live.
Times Live,
Times
okay.
Live and Sunday Sun. Just 2 quick questions. By Friday,
Our colleague Chriselda Lewis is on the story with the Health Minister, and she'll give us more detail coming out of the press briefing in a bit.